So is your opinion that it's just a slippery slope and we shouldn't go in that direction at all? Or should it be available for people, say, with motor neuron disease that are definitely suffering and definitely going to die relatively soon?
Yeah, I think that those are exactly the kind of questions to ask. So the term slippery slope, some people love it, some people hate it. Um, it can give you the idea that, like if you're on skis, if you push off the top of the slope, you'll go straight the way down to the bottom. It's really hard to stop. That's not always a great analogy, but what we often prefer to talk about is incremental extension. That once you've crossed that first barrier, you say, okay, terminal illness, great. Then what about people with chronic illness and disability? Then you say only people over 18. Well, what if you're 16 and mature? Or, then you say only with mental capacity. Well, what if you've got early onset dementia? We know that you don't want to, advanced dementia. So even though you don't quite qualify, maybe we should extend it that way. So it's very hard to keep a law at one place and never to change it. Virtually every jurisdiction that's changed the law has extended it further in different ways.
Yeah, that makes sense. I think one of the things I'm concerned, at least about in Canada, is, and I used to be in chronic pain from arthritis, and I had a number of surgeries for that, and getting access to pain medication. There was a 3 month waiting period when I
Yeah.
was 17. 3 months when you're in chronic pain, severe chronic pain, is a very, very long time. And so if the access to ending things, if it doesn't seem like you have some sort of future, is easier than the access to pain medication. And the healthcare system in Canada too is like, even though they think it's world class, it is not a world class healthcare system. So that's concerning. But I can also see where people are coming from, having watched people die of dementia slowly and painfully. I can see. Do you know what's happened in Switzerland? Because Switzerland's had more access to medically assisted death for a while, right? And even people from out of Switzerland can go and travel there for it. Do you know what the stats look like there? Like, is it more old people?
Yeah, so Switzerland is an unusual place. Yeah, they have had provision for assisted dying, I think, since the 1930s. And so some
Mm.
people in the UK who want to access that, but they can't do it in the UK, they will sometimes travel to Switzerland. And usually that's assisted suicide where the patient drinks the medication or takes the tablets. Sometimes it can be euthanasia. They're quite broad in the categories that they will allow. Many of the providers in Switzerland will only provide it to Swiss citizens, but there are a couple of organizations who will allow people from other countries to go there. And some people look at that and say, it's just been part of Swiss culture for years. We shouldn't worry about it. They haven't started killing everybody. It hasn't really extended massively. And I think there is a certain argument for that. But then you look at another country like Canada and you think, why has it gone so far, so fast, so quickly? And really changing the culture very fast. And people will sometimes point to Oregon in the USA and say, well, they've had it since 1997. The law hasn't changed much. That's the kind of law we want. But you can't promise that when you ask for Oregon that you won't get Canada. And you can't say, well, I like Switzerland, you might get Belgium, because um, attitudes to so many things are different in different cultures and things will have different effects. Switzerland is a very wealthy country. People have a very high standard of living, and there's I haven't looked at the stats in great detail there, but I think you'll have a lot less social deprivation.
Mm.
You'll have a lot less people who can't get access to the healthcare that they need. Whereas, very sadly, we're hearing in Canada some horrific stories of people who, you know, they just want good housing, they just want good medical care or social care, and actually they've got a constitutional right to be killed by the state. They can access MAID very quickly, but they can't access good housing. Like you said about the pain medication, you may not be able to get the health care that will actually reduce your suffering. And so that's a terrible situation to be in. We may say that doesn't happen very often, but it is happening in some situations. And if people say, if we're saying, well, you've got a right to access euthanasia, but you don't have a right to access prompt social and medical care, that's setting up a whole problem for us that I think we should be incredibly worried about. And especially when you've got cost of living crisis, you've got a mental health crisis, particularly after COVID. There's so many factors that should lead us to be very careful indeed.
Can you go into more detail about what's going on in Belgium? You said you can be euthanized against your will in some cases.
Yeah, so in Belgium and Holland have both had euthanasia for some years. Holland came first, and then Belgium, I think, was about 20 years ago. And they have seen that steady expansion of the criteria. So that to begin with in Belgium, again, it was just for terminally ill people. And now it's expanded gradually. People have become more comfortable with it. And then people are uh, less willing to actually go through the criteria properly, so that doctors become less careful about checking whether someone actually fulfills the criteria. If you go to one doctor and they say you don't fulfill them, then you can go to another doctor who says you do. And we have what you call doctor shopping, when people will go around and find a doctor that they know is positive about euthanasia, ask them, and then of course they'll help with them. Um, so in most situations, euthanasia would be what you call voluntary, when someone goes through different um, procedures, questions, and screening, so, things where you'd make sure that they really want to have the euthanasia, that they've actually looked at their options, maybe experienced palliative care or psychiatric care. They've maybe seen two doctors, so you can do that quite well, but in many situations you don't. And that would be voluntary euthanasia if you know for certain that the patient has requested it. You can have, on the other hand, non-voluntary euthanasia, when you just don't ask them. If, for instance, you had a patient who had advanced dementia, they may have said something in the past, if I ever get like this, I don't want to live. I would want to have euthanasia if I ever got severe dementia. The trouble is, when people actually get to that point, you don't know if their opinion then is the same as it would have been when they were healthy. Many people look differently on life when they actually are disabled or suffering in some ways, because the life that they didn't expect to have is still better than no life at all. But if someone's in advanced dementia and you think out of compassion they would want us to end their life, you can't get consent from them, but you might decide that that's the way to do it. Or you may just think, actually, it's too much difficulty to fill out the forms. And we're seeing some really, really bad cases in Belgium, I think, when people are just not going through the procedures because it's become more normal. So some elderly people, I understand, will go into hospital in Belgium actually trying to be really clear, do not give me euthanasia, because they're worried that actually somebody might make that decision for them. And then you've got involuntary euthanasia, when the patient may not even want it, but you decided it's the right thing for them. Now, thankfully, there are very few cases like that, but there was a case recently, I forget whether it was Holland or Belgium, but a patient had said previously that they would like euthanasia if their dementia got to a certain stage. It did progress. Then they said to them, would you like to have it? And they said no. Oh, that's a bit odd. Some days they'd say yes, some days they say no. Of course, it's dementia. It's hard to judge their mental capacity. It may fluctuate. And so then the family and the clinical team decided, okay, we're going to go ahead with it because that's what they said before. We'll give them some medication to make them drowsy. Then we'll give them further medication to end their life. The patient was actually, refusing, fighting it off, and actually then someone held them down while the doctor euthanized them, because they believed that that's what the patient would have wanted. And there was a criminal investigation there. Nobody was charged, and it's very rare in these situations, even when people don't follow the rules, it's very rare that anyone gets into trouble.
Have you heard in Canada about organ donation and euthanasia? What's going on with that?
Yeah, so my understanding is that quite a number of organs for transplant are now coming from patients with euthanasia. Clearly, if you have a medically controlled euthanasia, you can have everything set up to go. It may take place within a hospital. You could have anaesthetists and transplant surgeons on hand, so that the quality of the organs that you get is actually very good. You can have it very quickly between euthanasia and then organ harvesting. Now, I understand that organs coming from euthanasia cases, that the majority of those in the world are coming from Canada. Now, you can look at that and you say, well, isn't that a good thing? Because, this patient wants to die, but they want to contribute to help someone else live. Isn't that altruistic? And yes, it might be. But then, goodness, what sort of conflict is that putting someone in to say, well, actually, maybe I don't want to live, or maybe I'm a burden on my family. Maybe I should ask for euthanasia. Oh, and actually, I could then give my organs to someone else who may benefit from them. So there's an emotional pressure that really shouldn't be there.